Welcome to the Better Behavior Show with Dr. Nicole Beurkens, best-selling author, psychologist, nutritionist, and mom, where we'll be discussing ways to improve your child's attention, anxiety, mood, and behavior with simple strategies you can use right now. The following discussion is for educational purposes only and not intended to diagnose or treat any disorder. Please do not apply any of this information without first speaking with your doctor. Now, let's head to the show.
Hi, everyone. Welcome to the show. I'm Dr. Nicole, and today we're going to talk about how nutrition and diet impact sensory processing issues in kids. You know, many children, whether they're diagnosed with conditions or not, struggle with sensory issues. Maybe it's being bothered by things like touch or textures, being over-responsive to sounds, under-responsive to pain. There's a whole range of symptoms that fall in that realm of sensory processing, and they can be mild to severe. Most people that I come in contact with in my professional work and at the clinic are familiar with interventions like occupational therapy and specific sensory-focused therapy tools for addressing these issues. But really, nutrition and diet are overlooked, I think, when it comes to treating and addressing these things. And just like anything else, what we eat makes a big difference in how our brain functions, how our body functions, and this is absolutely true for sensory processing issues as well. So to help us understand the connection between diet and sensory systems, it is my pleasure to have Dr. Kendra Becker on the show today. Let me tell you a little bit about her. She's an integrated physician who's been in practice for over 10 years. She is Connecticut's 4A specialist, asthma, autism, allergies, and atopy/eczema. She holds an ND degree and an MS APRN. She's board certified in both of those areas. And her specialties include MTHFR, fertility, and treatment of the 4As. Dr. Becker focuses on primarily treating the pediatric population and their parents. She's an adjunct faculty at 2 prominent universities where she teaches physicians and medical students and precepts student doctors and nurse practitioners. Dr. Becker lectures all over the country on topics such as autism, the immune system, MTHFR, and genetic mutations that have health implications. She's the author of A Delicious Way to Heal the Gut and All You Can Eat, and was chosen as one of Connecticut's top naturopathic doctors and 10 best APRNs. Dr. Becker, it is a pleasure to have you on the show today. Welcome.
Well, thank you so much. I am so honored to be here. I feel like it's been such a long time in coming, too.
Yes. Absolutely. And I'm just super excited to cover this topic because I think this is going to be really eye-opening for so many of the parents who listen to the show. So let's dive in. I want to start by asking you, how did you get involved with this kind of work? You've got a really interesting, background professionally. What led you to doing the kind of work that you're doing today?
So I always wanted to help people. And I went to college originally for pre-med and got through my first year and kind of looked at the timeline and realized it's so funny. Like when I tell the story, I laugh at myself because of course it ended up taking me longer doing what I did. I looked at the timeline and I was like, I want to be married and I want to have kids. And that's like too many years for me to do what I want to do in my career and still be a mommy. So I quickly did an about face and decided I was going to go to nursing school. I literally went to nursing school thinking I was going to be the next Florence Nightingale. Years as a nurse, I loved it. I was in the cardiac ICU, I was in the trauma ICU, I was in the pediatric ICU. But I worked in Southern California in the 90s, in the late 90s. So at that point, that's when HMOs were starting to roll out. And so my aha moment was, well, first of all, I was in San Diego. So at that point, San Diego was still really like the Wild West. We didn't have scales to hold people that were over 300 pounds. Mm-hmm. Have the ability to even hold patients on cardiac cath tables that were over 300 or 350 pounds. They were so bad at healthcare at the time. It was really interesting. The other thing about San Diego was there was so much focus on health. There was so much focus on being a human and interacting naturally with nature. So all the fun things that you could do as a human were free. The parks, the beach, riding your bike, and all of these things were so readily available. So it was really easy to focus on health and healing. So aha moment came one day when I was in the ICU, and this is in the day of fax machines. So I admit my patient. I have no information on him. So I go over to the fax machine and I get the admission paperwork, which is generally all the orders that the doctors write. So as I'm standing there reading and signing off on the orders for my new patient, the paper that comes over the fax next was his discharge paperwork. Nobody had seen the patient. He was admitted and discharged basically with the same swipe of a pen. And I was like, that was that moment where I was like, we owe patients better care than this. And it was literally from that moment, I quit my job. I applied to naturopathic school, relocated back to the East Coast, and started my kind of journey with naturopathic medicine. And so it was just really interesting that that's how it happened. But what was happening in naturopathic school at the time was there was people who were doing a lot of second career stuff like I was, but they weren't medical professionals. And so I went into school being able to talk to patients and handle patients and use medical terminology. And I was familiar with pharmaceuticals, and a lot of my contemporaries weren't at the time. So I really felt like I kind of had a leg up. But I was in Connecticut, and Connecticut didn't allow for the pharmaceutical prescriptive right that the APRN practice did, which is, I mean, that's a conversation for another day, that a practitioner like an APRN can prescribe pharmaceuticals, but a medical physician can't. And so because of what I wanted to do with practice, I treat Lyme disease, and there are some opportunities where pharmaceutical medications are very, very swift and effective to be able to offer that to my patients. So concomitantly, while in naturopathic school, I actually started my APRN program. They saw me coming like I was a unicorn, right? Nobody in a natural nurse who had wanted to go back to APRN school. So the school I went to transferred in a ton of my medical school credits in very little time that I really had to put in for my APRN. And then I had a baby. And so I came out in 2007 with a baby, an ND degree in 2005, and my APRN in 2007. I was like, well, there you go. Now it is what it is. So I practice, and nobody really knew what a naturopath was. And the truth is that I did practice like a naturopath, but just had this extra credential. After being a nurse, and especially being in San Diego, where the number one career for females in San Diego was nursing, like everyone was a nurse, going to what a naturopath is, it took me like almost 10 years to come up with like my elevator speech as to what a naturopath. So after kind of being really frustrated and trying to qualify the type of medicine that I practiced, I was like, maybe this just isn't for me. Like I kept saying to my husband, like, do I just need to go and work in a minute clinic and do like throat cultures? And he said, well, what do you want to do? And I said, I want to treat kids. And I our kids to have a better chance based in the environment that they currently live in. And so he was like, well, then my husband said to me, well, then do that. And so from that point forward, I really started, a pretty, narrow and deep pediatric practice. But about years ago, I brought in the genetic component. And so with genetics, because genetics are, of course, familial, is the children generally start first in my practice. Then I see the parents, and in many occasions, I also see the grandparents. So I feel very fortunate with having the ability to really help an entire, family unit of 3-4 generations really facilitate healing for them based on their genetic, aptitudes and abilities. And so it's kind of a really nice practice that I have now. And so I'm not changing anything.
I love it. I love the story. We all have such interesting stories and paths that we've taken to get to doing this kind of work. Most of us who are sort of unicorns in our field, our stories are just interesting. Right. And so I love hearing that progression for you. And I also really love the focus on sort of this multi-generational family care. And I think we see that a lot too, the initial patient that's brought in is the child. And then as we start, working with that, it's like, they start working with the parents or the siblings or other family members. And it's really fun that way.
Right.
I'm curious, we're going to focus in on sensory issues. Mm-hmm. What are some of the common types of sensory processing or sensory integration issues that you see just across the board? Because you do see a lot of children. What are some of the common ones that you see?
The clothing stuff, right? The seams on the socks, the seams jeans, the zippers, the buttons is a big part of it. And that can be, and some of my happiest emails and text messages are from my patients that text me pictures of their 4 and 5-year-olds, like wearing a pair of Levi's jeans. Mm-hmm. Clothing is huge. Although I will say, I was having this conversation with my son, and I was like, I think I was this way. Like my mother made fun of me, and she says, listen, we cut out all the tags of your clothes because you couldn't handle any of them. She said, I never could pass the clothes along. I always gave them away because they never had sizes in them. I think these were all things that we've all seen throughout our society that nobody really connected or diagnosed. So, and I think the other thing that I see a lot is like the sound sensitivities, that are fearful of, the school alarms, that anticipation for kids that are in school is paralyzing. That anxiety is paralyzing. Sometimes the motion stuff, like the kids that, struggle with the car rides or the amusement park rides, or, even going up and down in an elevator or an escalator. So those are real common ones, but there's all of them. There's people that have very weird, sensations on their skin, or have to sleep in a certain position. One ear has tinnitus and the other one doesn't. I mean, you see all kinds of crazy stuff over time, but those to be the largest.
Yeah. And I think, those can range, from mild to severe, as you're mentioning. Some of them really can severely impact, even regardless of what other diagnosis a child may have. Some of the sensory processing stuff is really, from a functional standpoint, some of the stuff that impacts their quality of life, the most. So I'm excited. You talk a lot about food and diet and how that's such a big component of really functioning well and healing from anything. Let's start talking about food as it relates to sensory issues, particularly something that I think many people aren't aware of. What kinds of foods can actually cause or worsen sensory issues? Because I think most people don't really think about that, but that's a big deal.
Oh, it's a huge deal. And so the number one is, I would say on my list, is probably gluten. The number two on my list is sugar. Number three is probably the dyes and the preservatives, and kind of like a general tie around 4 or 5, which is like dairy, corn, soy, some of the other preservatives that are natural in nature but can still affect kids. Salicylates and phenols are on that list as well. Gluten, in my opinion, is the biggest perpetrator, and there's just so much about gluten that is challenging. I mean, it is not the wheat that our grandparents ate. Certainly wheat that the pioneers in America ate, 200 years ago. But what we've done to it by hybridization and, just all the chemicals and pesticides and then the processing has fit into something that is completely unrecognizable to the body. But the only thing that is recognizable to the body is that protein, which is called gluten. And it's called gluten, and it has the word glue in it because it actually works like glue in the body. So the way that I explain it to the kids in my practice, because, when you hear these poor patients, they wait like 4 months to get into my office. From everybody, how there's been dramatic reversals, in their friends and families' lives, this, that, and the other thing. They come to my office, they get a probiotic and a healing diet, and I see them again for 4 months. And so I explain to the kids why we're doing the diet. And so the gluten I always explain to is that it is sticky like glue. It sticks in different areas of the brain, and then it literally becomes an itch you can't scratch, like a mosquito bite. So, which is very easy for young children to understand. Like, how distracting is a mosquito bite that you can itch and scratch and then it gets red and irritated? Well, that same process actually goes on in our brain, especially if we have sensory, challenges or genetics that don't tolerate gluten anyway, that becomes this area of the brain that becomes hyper swollen and sensitive, and then those feelings or behaviors or whatever become enhanced. And it's really important to note, which is why there is known conditions like gluten ataxia, right, where part of the motion system in the brain is affected by the amount of gluten that's stuck there. Certainly anxiety, depression, anger, impulsivity, all of the things are certainly well-known areas of the brain, but absolutely affected by gluten and gluten sensitivity. That's the number one. And of course, even if your gut is perfect and your blood-brain barrier is perfect and everything is happy and your microbiome is perfectly balanced, if you eat gluten, you can, because it is so inflammatory, have a leaky gut for up to 3 hours after that ingestion. So, I mean, even in the most perfect circumstances, now, if it is perfect, then 3 hours of a leaky gut is probably not a big deal for that perfect specimen. But if you have a child that has a leaky gut and has a leaky blood-brain barrier and has allergies and things that I see on a regular basis, constant exposure to gluten, and we all know our kids eat way more than every 3 hours, really certainly wreak havoc and, enhance the amount of sensory symptoms we're seeing in those little bodies.
I totally agree. And I love that description of how you talk with kids about that. I think that's such a helpful, tangible way for them to think about gluten and what's happening in the brain. So you said gluten is the sort of the big one, the top one that you see as causing or impacting the sensory systems.
Right.
And then the second one that you said, was it the
Sugar.
the sugar? Yeah. Okay. Talk a little bit about that.
So sugar is, you have to think about what sugar does. And so I just said the other day, I had seen a statistic. I have a 9-year-old son, and the current statistic is 8-year-old children in this country have consumed more sugar in their 8 years on this planet than their grandfathers did in their lifetime.
Wow.
So, let's think about that. You know what I mean? And so the problem with sugar is sugar is supposed to be used as a very, very quick energy source. So if you're a caveman running from a dinosaur, put a few sugar cubes in your mouth and go and run, 30 miles at 30 miles an hour. And that's what you use the sugar for. The problem is in little kids, what happens is they consume so much sugar that it starts to wreak havoc with their blood sugar. So sugar goes up, then their blood sugar goes down, their blood sugar goes up, their blood sugar goes down. Sugar is abundantly wonderful at really hitting the pleasure centers of the brain. So humans are always inclined toward pleasure and will run screaming from pain. Did you like that? Pun intended.
Yes.
And what happens is that when you kind of tick that pleasure center, the body always desires what's going to give them pleasures. And we know sugar is 10 times or 100 times more addictive than, the illegal drug cocaine. So we know that this is a physiologic addiction that these kids have. When you have, first of all, that pleasure-seeking behavior, then you get kind of a return on your investment. You're kind of like a Superman, right? You hear from parents all the time, oh my gosh, my kid gets so hyper. Oh my gosh, my kid is so impulsive. The other thing that happens, particularly in little boys, and I'm going to do a study, is when little boys eat a lot of sugar, sometimes, and little girls too, but it's more common in little boys, they have a little bit of like a diabetes insipidus kind of reaction. Their body says, oh my gosh, there's too much sugar in my system. I have to pee it off. So these little kids eat a bunch of sugar and then they're in the bathroom peeing, 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 peeing. Something that I noticed in my own kid, my kids were potty trained really early. So we spent a lot of time in public potties. When you're a 2-year-old that's potty trained, their bladder, they're still 2, they're tiny. So you're in, where every bathroom is, within 100 feet of your body. And so, I noticed we were out somewhere and my son was like, I gotta pee. I'm like, you're 2. Like, what is a possible problem? And so on that particular day, when I had first kind of noticed it and put the connection together, he was eating like, carries around all his, his ready pack of food, and it was granola bars. Like he had to vary from his diet. And so all of that was just too much sugar for his little body, that I noticed that his little body was just trying to get rid of it all. Tends to be a really common process. So, as far as sensory issues go, there's certainly tons of them because it does affect behavior. And so anything that's already a challenge with behavior can get way, way worse if you include a lot of sugar.
Yeah. And I see that too, where sugar is just a significant component of those kinds of behavioral issues and sensory issues in kids. And that's it shouldn't be surprising to me, seeing kids all day long and what they're eating. But that statistic about, that the average 8-year-old has already eaten more sugar than their grandfather had in a lifetime. That's food for thought right there for sure. And then you mentioned also the chemicals and some of the dyes and things like that. I do notice for some kids, especially with sensory things, that can be an issue. What do you see with that?
So it depends on the chemicals and the dyes. The colors in particular, the colors and preservatives are kind of in their own group. And with those kids, what I see a lot, and the way the parents describe it is my favorite. They're like, he's mean. They don't say he went outside and chopped up a frog. They don't say he ran out and into traffic, although that does happen too. They just go, he's mean. And you never, because you treat kids all the time, like you never, ever, ever discount the account of a parent who knows that kid inside and out. And so it always, I love when they come in and they're like, he's mean. And I'm like, that's dyes, that's all the dye, And so we have that conversation. And I don't know what it is about the dyes that actually create that kind of aggressive, angry, unsettled kind of behavior in little kids, but I've seen it time and time again. And then like MSG, and other glutamates, that's a little different. Like sometimes kids can even get like physically muscle twitchy from those sorts of things. But what you see there, like if you're getting a physical muscle twitch, you have to remember that same acetylcholine reaction is going on in the brain. So whatever it is that's twitching externally is twitching internally. So that can be any number of things. That can certainly be anxiety reactions, it can be headache reactions, it can be sweating reactions, it can be emotional lability, activity. And so that's a little bit different and can be a little harder to tease out. Definitely. And the things with the chemicals and the dyes, that in a lot of cases is super, super easy for people to just remove from their diet.
Yeah, absolutely. And I want to get into some of the strategies for that in a minute. I'm curious, as you're talking about, there certainly is overlap for so many kids symptom-wise, right? I mean, I can't even think of a child I've ever seen who had significant sensory issues who didn't also have, several other either physical issues or brain-based issues going on. I'm curious, what are some of the physical symptoms that you see? You mentioned things like allergies, some gut issues, because I think a lot of times, because in the field of medicine or healthcare, we separate things out. Well, this is this and that's that. And you and I look at things in a very integrative way, but I think a lot of parents don't know to connect the dots. So may not realize that, like, oh, my child's having these sensory, issues, but is also, chronically constipated, or that all of those things are connected. So I'd like for you to just take a minute to talk about some of the overlap of that and some of the physical symptoms you see in these kids.
Right. So there is a lot of overlap with, my 4 A's, the asthma, the allergy, the eczema, and the autism, number one. And thing I see a lot, almost overwhelmingly, is low tone, right? So the low tone affects, again, it's multi-systemic. So you certainly have problems with gait and balance. You certainly have problems with constipation and pooping and all the gut mediated stuff. Sometimes there's problems with respiratory, if there's a substantial lordosis in the back and we're really concerned about, diaphragmatic breathing. Sometimes there's even endocrine components. So there absolutely positively a lot of overlap. But conversely, healing and sealing the gut and fixing the diet a lot of times is literally the only remedy you need. And that's is the amazing part.
Mm-hmm. Well, I think that's the thing is, people will come and they'll say, my child has all of these different problems. And I'm like, well, the good news is that there's a few foundational things that we can do that when you get those in place will resolve all of these, what seem to be very different issues. So let's dive into that, because I know that listeners are now thinking, okay, I get the connections here. What can I do? So what are some simple steps that parents, that people who are listening today can use to support their, child's healing when they've got these sensory kinds of things going on?
So the first thing is the diet, right? Period. End of story. The diet. So depending on how you need to structure that or how you need to go through the elimination is really very unique and personalized. But removing any one of those things on the list that we had talked about gives you ammunition as to whether or not it's a cause or effect. The only caveat to that is, removing something like dairy or corn from the diet, you can probably see results in a week or two. It's to eliminate one food at a time or one food group, like all of the chemicals or all of the food dyes or whatever. And then you kind of have your answer. And, with those sorts of things, the MSG and the preservatives and the food dyes, you kind of know in a couple of days. Mm-hmm. Dairy, soy, corn also clears from the body in very short order in a week or two. Gluten takes much longer. So what I do recommend in many cases is I say, just go to gluten-free food, and just make sure it's organic, make sure it's relatively low in sugar count, because we all know what happened with that gluten-free revolution. Yeah. Those of us that jumped on the train early, we all ended up sensitive to corn because we swapped everything out for corn. And then those of us that kind of jumped on the train a little later ended up, with all these high sugar, high calorie, nutrient poor foods. So certainly going from gluten to gluten free, you have to be mindful about it. Like for you to go from gluten, processed food to gluten free processed food, but certainly going to a more whole foods diet can make a huge difference. Now, I have one story in my office. I had a little boy who had a very early diagnosis of autism, and the mother was a healthcare provider, and I was kind of shocked that she had come in my office. Like you forget sometimes what people know and what they don't know. And I said, "Is he on a gluten-free diet?" "No, should he be?" And I said, "Yeah." I mean, the poor woman was supposed to be in there an hour with like a 5-minute visit. So I saw her 6 weeks later, and she said, "You would not believe the amount of language reversal that I saw in like 4 days." So, I mean, the stories are absolutely remarkable.
And it's interesting, people often minimize the role of diet, like, oh, does it make a difference? And sadly, a lot of the medical profession writes that off too. And yet you and I see daily really the profound effect that something like a simple food change or diet change can have. And it's just unfortunate, number one, that more providers aren't aware of that and aren't promoting that, with parents, which is a big part of why I enjoy doing this podcast, to spread this message to people that a lot of times these things don't have to be real complicated. Like, as you said, you remove something and you observe the difference, and sometimes you see really profound things really quickly.
Absolutely. Absolutely. And that's the other thing too, is I think there's so much propaganda out there in conventional medicine where, everything is, even like with people with IBS and colitis, it always makes me laugh when my patients tell me time and time again that their doctors say diet has nothing to do with the fact that they're having raging pain and symptoms in their digestive system. So, I think that a lot of times it's more reinforcement. I really feel like most of these parents know this and just want the encouragement that they're actually going to see a positive change. But it's remarkable. It's absolutely remarkable what you can see and what you can do with diet alone. I fully agree with that.
So one step that parents can take is starting to look at each of these types of foods or groups of foods that you've mentioned and eliminating them for a period of time to see what the response is. You also mentioned that it's important to look at more of a whole foods, reducing the processed foods, reducing the processed sugars, those kinds of things. Are there other things that you would recommend, either as starting points or as just simple things that parents can do nutrition-wise or food-wise to support the sensory processing issues?
So I'm a big advocate of turning off your Wi-Fi, and so what I say to begin with, because that's another thing that gives people the sweats, is turn your Wi-Fi off at night while you're sleeping. Then when they come back, I say, turn your Wi-Fi off except for the 2 hours a day that you're in the house using the Wi-Fi. Because there are the exceptions of people who work from home and things like that always. But for the most part, if we're using our Wi-Fi, it's literally for 2 hours when we get home. After, when the kids are home from school, it's a very, very short period of time. Wi-Fi, when you think about really what Wi-Fi is, like it's waves that constantly are pinging at any solid source. So your furniture, your body, all those things. So to kind of remove that pinging, that constant, against your own cells can make a huge difference. And accounts of kids that have, kind of hyper-stimulating behavior, they'll stim like standing in front of the dishwasher because there's a lot of electricity there. Stim standing in front of the washing machine. Same thing, as they get closer to their Wi-Fi router. But, if you can eliminate those things, and that's a really easy fix that we all should be doing to really help our sleep and our own mental health, so absolutely.
Yeah, agreed. And I did a really interesting interview with Peter Sullivan recently about all of those issues. It really is profound, the impact that just having all of that in the environment, and we tend not to think about it, right? It's like we can't see it, so we don't think about it. But I too have seen kids where that makes a tremendous impact. I'm curious from a nutrient standpoint, do you find, or do you, in your practice find that there's any particular types of nutrients or supplements that you feel like are particularly helpful for kids with a lot of these more significant sensory issues?
I wish I'd be a very rich woman.
Yeah.
The problem is that, especially in my practice, that most of my patients are such complex methylators that there is absolutely no one size fits all, which includes probiotics, right? We know that there are certain strains that can enhance histamine, that can cause anxiety. So there's no, one size fits all, supplement protocol across the board, unfortunately. And quite honestly, I would much rather have, children in particular get their lion's share of nutrients and be balanced through their food.
Yeah.
In many cases, I have used probiotics, I've used fish oils. Vitamin D can be very helpful. Certainly any combination of B vitamins, depending on what you're seeing in that patient, can be really helpful. You can use, histamine mediators or modulators in a lot of cases, but the treatment itself is very, very individualized based on what you're seeing and what the needs of that child and that family are.
Yeah, I think it's helpful for parents to know that there can be specific targeted nutrients depending on your child's specific issues that may be helpful. And to your point, that it is valuable to seek out a practitioner who understands those individualities and those issues, to look at what targeted things might be helpful there.
For sure. Absolutely.
Yeah. But I think the food piece is so critical, and you really honed in on that. And I think that gives a lot of hope to families, to parents who are dealing with these kinds of things, that, wow, we can start even just making some simple shifts in diet and observing what happens with this. And really parents can be their own detective, in that way. And you gave some clear groups of foods and things to try. So I think that that's really helpful. I want to make sure before we wrap up here that people know where they can access your books, because you've got some fabulous books and resources online. Where's the best place for people to go online to find you?
So my website is probably the best place, drkendrabecker.com. My books are available on Amazon and all the major, online and brick and mortar booksellers. And for those of you, brand new information, I'm sharing it with your audience first, Dr. Nicole, is I have a course that I'm launching toward the middle of this month that is called Keeping Healing in the Home. It's 8 modules of all kinds of information that you can keep at home. So instead of showing up at the urgent care or scheduling a doctor's visit that's going to end up being useless to you, tools at your home, at your fingertips and at your disposal to be able to kind of keep your healing in the home. So that's also coming up. And if you guys are interested, certainly sign up on my mailing list on my website, and that information will get out to you guys first.
Love it. That is fantastic. Thank you for making that available and for telling our listeners about that. And we will have, as always, all the links to everything that Dr. Becker is mentioning on the podcast page along with the episode. So you'll be able to easily just click to things from there. Definitely recommend you check out her books, her program, her other resources, great blog posts, things like that. Thank you so much for being with us today. This was a great conversation. Really enjoyed sharing this time with you. Thank you for being here.
Oh, thanks for having me. I'm honored.
All right, everybody, that does it for this episode of the Better Behavior Show. We'll see you back here next time.
Thank you for listening to the Better Behavior Show with Dr. Nicole Beurkens. Leave a review on iTunes and share this episode with your friends. Visit drbeurkens.com to ask any questions for an upcoming episode, post comments for today's show, and sign up to receive weekly updates. That's drbeurkens.com.